Lucy, or love make us better. A man came in with a carrier. May I leave my cat for a moment? I need to feed the parking meter. I'll be back shortly. He stepped out and never came back. In the carrier there was a beautiful white Persian cat. We had no choice but to put up the cat for adoption. Having no idea about his health status, we had to vaccinate her and check for fleas and contagious diseases. The animal we met up for adoption have to be spayed, but due to small hope that the owner would come back sometimes in the next couple of days, who knows, maybe he got an emergency call or something else happened. Such things have happened rarely indeed, but they have occurred before. We left her intact for a while. After a week or two, our hopes died and we became sure the cat was ours, so we named her Lucy. Not a big deal. To surface to say that everybody in our office liked this charming, top-quality, purebred Persian. During the waiting period, we noted that her belly had started to grow and she appeared to be pregnant. The cat delivered 3 gorgeous white Persian kittens, 1 boy and 2 girls. There was no deficit of people who wanted those babies. We sold them and it covered all expenses for Lucy carers. As soon as the kittens left, Lucy changed her behavior. It was not the result of her separation from kittens. Several weeks before the kittens had been taken from Lucy, was apparently oppressed by them, and previously friendly cat became furious. She was periodically aggressive and hissed at those who had pet her many times before. One day she attacked an employee while cleaning her room, and the next day when I pet her she bit my arm. It was serious. There were 4 holes in her canines that bled a lot. It became a problem. Knowing about her aggressive behavior, we couldn't in good conscience adopt her. But we also did not want to put her down. Until we could find a solution, we put her in a cage with the cat boarding department, where Lucy immediately recognized a rare bird, a non-neutered male cat. Intact male cats are so smelly that there were few of them living in people's home. We too tried to avoid such stinky guests, but this cat belongs to a breeder who had given us a lot of business and we could not reject him. One wayward move by the employee who was cleaning the cat cages, and Lucy leaped into the male's cage. Sex between them was very active for a period of 2 or 3 days, and then our Lucy was the same as before. She was sweet and charming, very friendly, and often requested petting. There was no hissing and no attack. Big belly delivery, 4 white kittens, lovely feline family. Then oppression by kittens. Kittens gone. Lucy is again aggressive as a tiger. Now we know how to treat her bad mood. A sexy, intact male can dissolve her aggressiveness in a moment. A couple of days of love, sex, pregnancy, kittens, and the whole cycle begins again. Sweet while pregnant, furious while in heat. Lucy came to us, we think, when she was approximately 6 years old. Her periods of heat repeated with regularity of good watch. As soon as her kittens reached their 9th week, she had been introduced to intact male cat. Otherwise, she would attack somebody. Yes, feline breeders prefer not to impregnate females more than once a year, but we had no choice, allow her have sex or be beaten. Depression from azoospermia. The appointment was for artificial insemination. Sometimes the breeding of dogs is difficult to do naturally. This time there was 2 giant dogs who needed our help in order to continue their lineage. The massive Mastitis Napolitano felt sexually excited, but were unable to fulfill their desires. Neither was young or groom was 4-year-old, and Bright was even older, so naturally they would have gotten into their sexual experience at early age. Not only did delayed virginity evolve into a problem, the boy was so massive compared to the girl that she simply couldn't hold his weight. But due to aggressiveness, she did not allow us to help her during intercourse. When this procedure had to be performed artificial, there is a good reason and easy access to the male product, and doctor can evaluate the quality of sperm. The microscopy was done and there was unusual discovery. It turned out the male was infertile. He produced a lot of semen and it appeared to be good quality, but there was no sperm in it at all. This is rare, but it happens. It's called azoospermia. The good thing is that the doctor discovered this before injecting the male's product into the uterus, so the female owner was able to switch the groom in time to get puppies that season, and that would be no fight between the owners of the males about whose puppies would be born. It sounds like everything worked out, until you take into account the fact that owner of the first boy took the incident so personally. It was so close to his heart. He was as ashamed as little girl who farted in the middle of the class. He imported everybody not to say anything about this disgrace. He acted as if the misfortune happened not to his dog but to him, as if somehow it was his fault. Then we saw the tears on the face of this 6'5" tall gentleman. We were vowed to keep his secret in our confidential medical file. C-sections. An emergency situation can often occur due to labor or delivery complications. Sometimes they are unavoidable. It is hard to predict which pregnant cat or dog will need veterinarian help during the seemingly routine event. But there are certain warning signs, breed, age, etc. For instance, females belonging to the breed with rotted hearts, like Persian cats and bulldogs, tend to require C-section more frequently than other breeds. Delivery complications are also common among tiny breeds like Chihuahua, miniature poodles, and schnauzers. But even for females belongs to low-risk categories, it is a good idea to receive a vet checkup ahead of delivery. It is not uncommon, for instance, for one embryo to grow so big that it makes the birthing process more complicated than if the mother had been carrying several smaller babies. Of course, there is no guarantee in such cases. Either once a while it might happen that 5 to 10 babies are in the womb and one of them is slightly bigger than others. Unfortunately, the giant will try to get out first, and it might get stuck and make it difficult for the others to get out. Another problem is a delivery tends to occur during the night. We teach the owners of potential new litters to recognize the impending delivery a day ahead of the event, but not every owner follows our recommendation. Of course, a planned C-section is more convenient both for the clinic and for the owner, and the planned female isn't easy to schedule a room for the operation, and procedure can be done during the day, which is obviously better than doing at night. The worst case scenario is when the bat belongs to a loyal client whom we do not feel comfortable seeing sending to a specialized emergency hospital, and the doctor and team has to stay at work or even come to unexpectedly at night during off-duty hours. Miss Cherry was a renowned pug breeder and one of our pain in the ass clients. Her show dog female was preparing for her first delivery. The X-ray confirmed there were 2 embryos, one of them twice as big as the other. The day of delivery was well calculated. The doctor offered her to stimulate the mother to be in the morning so we could have several hours to supervise the birth and perform C-section if necessary. The breeder asked for an estimate and refused our price. She was trying to save money and hoping chance that process could happen without intervention. Several phone calls in an attempt to convince her accomplished nothing. During the evening, the beach started pushing, but nothing, safe from fluids, was coming out. 10 minutes before the night shift ended, Miss Cherry came back and accepted unavoidable. The doctor not only had to perform C-section, but also had a hard time restarting the heartbeat and breathing of the giant newborn puppy. It has been stuck inside the birth canal for too long. Finally, when everybody was aware and stable, it was time to pay the bill. But there was a problem. The owner insisted on paying the amount estimated to her in the morning, that morning, while we maintained the extended hours and complicated revision deserved extra compensation. A teenage girl brought in her tiny, lethargic Dutch hound. There was no external symptoms that could direct us to a diagnosis. The X-ray revealed that the dog was pregnant, and it looks like delivery was past due. The ultrasound confirmed that embryo was dead. Our question about mating date received no answer. The dog has no idea how the dog got pregnant. She told us there were no other dogs living in the house, and that when she went outside, she usually accompanied by human. Usually, that means there were times when she walked outside by herself, decided the vet. The C-section and spaying was the only way to save the life of poor Dutch hound. The owner, who was likely an experienced owner, had not recognized the proper time to run to the vet, and unfortunately would-be mother suffered toxicity from the dead body in her unborn son. The endoscopy of the embryo revealed that it has been dead for at least a week, and the would-be puppy was giant, fully formed, and it looked like he was half Rottweiler. The whole family, the mother and father and two beautiful 20-year-old daughters, brought in their Shih Tzu for C-section. We knew the family very well. The parents had brought the female Shih Tzu in order to teach their daughters how to take care of somebody who depending on them, and they explained to teach them about some gender-related issues. The family knew that their four-legged younger daughter would be delivering 7 puppies, as well as the exact date of delivery. Also, they followed vet instructions. If the first puppy did not come out within 6 hours of the first sign of labor, they would have to go to a hospital. So here they are aware. The girl's pushes were sporadic and weak. The doctor stimulated her with oxytocin to not available. C-section was only a choice. Surgery went well, and soon 7 puppies, Greek and small even for that breed, were in our hands. The doctor was still busy with the mother, while all the puppies needed attention and help in dyeing of their coats and massage to stimulate blood flow, to help them breathe successfully, etc. We took the newborns out of surgery room, and everybody was available to receive a puppy to work with. The manager, the technician, the receptionist, the mother and the father, and even the 2 young girls. It was a wonderful collaboration between members of supportive team. The older girl decided that she would be a doctor when she grew up, and the younger one promised. Car accidents. It doesn't happen too often, but once in a while animals, both family pets and strays, are involved in car accidents. Stray cats like to hide under parked cars. Dogs are more active and communicate while not on leash. Might cross the street if they see interesting animal or hear a sudden sound. It's risky. If a heavy car hits a small animal, it usually kills them, but a certain percentage of these accidents cause trauma that can be handled with quick and proper help, allowing the animal to survive. Our doctor's neighbor opened the door to throw away his garbage, and his miniature pincher ran out. Unfortunately, another neighbor had started his car at the same moment. The speed has not yet accelerated, and this saved the life of the pincher. Impact was light. Anyway, the dog's hip was broken, and there were huge blood-covered bruises all over his side. The dog was choking from the pain, which could have been more life-threatening than the trauma alone. Fortunately, the doctor was there and started treatment right away. They brought the pinscher to the clinic, and the necessary diagnostic tests, supportive treatment were quickly administered. Within a month, the pinscher was pretty much back to normal, but his fear of car was lasting. Now he refused to come close to standing car, including the car of his owner. Several severe punishment help you learn fast. The cat fell asleep under the car, and when the engine revived up, she panicked and ran out right when the car can start to turn its wheels. The poor cat rolled like a ball, and a teenager happened to pass by, spotted the car, took it in his arm, and ran to our clinic. There was no visible damage to the cat, but her condition kept deteriorating. Suspected internal bleeding, the doctor opened the belly and found disruption to the cat's liver. Disruption could be fixed, but the cat needed a blood transfusion to compensate for her loss. We asked any clients who had brought their cats for a checkup that day to donate some blood. All of them sympathized with the injured cat, but nobody agreed to do it. They just stared at the waiting room floor. Luckily, one of our technicians who lived close by had a healthy cat and agreed to help. The doctor performed the transfusion, but the injured cat needed more blood than we could take from one cat without hurting him. We gave a call to several rescue people and found that one of them had a couple of cats for adoption. The doctor checked those cats for contagious diseases and took blood from them. Since then, we have always kept an eye out on orphan dogs and cats as potential donors. Just in case, a visitor brought his beagle for a checkup. Doctor, please find something wrong with my dog. Well, there is a strange request, said the doctor. Why are you so worried about your pet? Did you notice anything abnormal? Okay, doctor, I just got into the car accident. My dog was in the car with this was noted by the police report. My insurance company has no fault policy. Maybe I can get some money for my dog too.